As IgA nephropathy progresses, it means that the condition continues to worsen over time. Unfortunately, there is no cure for this condition, but there are treatments available that can help slow down the damage to the kidneys and prolong their function. It's important to be aware of what to expect as the condition progresses. This includes being able to recognize the signs of kidney failure and understanding the options available if your kidneys do eventually stop functioning. As IgA nephropathy progresses, the timeline varies for each person. Some may not have any symptoms at all, while others may experience blood in their urine. In some cases, the kidneys may continue to function normally, while others may progress to end-stage renal disease, ESRD, or kidney failure over varying periods of time. Treatment with medications can help put IgA nephropathy into remission, where the signs and symptoms of the disease disappear. However, for about 1 in 4 people with IgA nephropathy, kidney damage may lead to kidney failure within 10 to 20 years. The rest may either go into remission or continue to have protein and/or blood in their urine without serious kidney damage. As IgA nephropathy progresses, the inflammation in your kidneys can lead to scarring, which can cause blood and protein to leak into your urine. If the scarring becomes severe enough, it can result in end-stage renal disease, where your kidneys are no longer able to filter waste from your blood. At this stage, dialysis or a kidney transplant may be necessary to support the function of your damaged kidneys. As IgA nephropathy progresses, there are certain factors that may cause it to advance more quickly. These include large amounts of protein or blood in your pee, high blood pressure that isn't well controlled, worsened kidney function as determined by blood tests, scarring in your kidneys' filters, which can be measured on a kidney biopsy. Your doctor can use a test called the International IgA Nephropathy Prediction Tool to predict how likely your condition is to get worse within the next 5 years. There are also steps you can take to slow down the progression of IgA nephropathy, such as losing weight if you're very overweight, eating fewer saturated fats, quitting smoking, and watching your salt intake. As IgA nephropathy progresses to end-stage kidney failure, also known as ESRD, your kidneys will no longer work well enough to keep your body healthy. You may experience signs such as tiredness, weakness, nausea, vomiting, little to no urine when you pee, itching, weight loss, headache, poor appetite, and a metallic taste in your mouth. You might also have shortness of breath or chest pain if extra fluid collects in your lungs, and swelling in your feet or ankles due to fluid buildup. Your doctor can check for ESRD with blood tests, urine tests, imaging tests like ultrasound and CT scans, and a biopsy to check for kidney damage. As IgA nephropathy progresses, it can lead to kidney failure. This means that you have lost more than 85 to 90% of your kidney function. At this point, your kidneys will not get better, and you'll need either dialysis or a kidney transplant to help remove wastes and fluid from your body. Dialysis is a treatment that helps to filter wastes and fluids from your blood and control your blood pressure. There are 2 types of dialysis. Hemodialysis uses a machine to filter your blood, which takes 3 to 5 hours and can be done at a hospital, dialysis center, or at home. Peritoneal dialysis filters your blood inside your belly using a special cleansing solution, and can be done at home with instructions from your doctor. A kidney transplant is a long-term treatment for kidney failure that can give you the freedom of not having to do dialysis several times a week. Studies show that people who get a kidney transplant live longer than those who use dialysis. However, a transplant involves surgery and you'll need a donor. The donor kidney can come from someone who has died, called a deceased donor, or from a living donor who is willing to give up one of their 2 kidneys. There are risks to having a kidney transplant. You will have to take medication for the rest of your life to keep your body from rejecting the organ. And the transplant may not be permanent. Some people need a second transplant in the future if their donated kidney stops working. If you do get to kidney failure, talk with your doctor about your options. Make sure you understand the pros and cons of dialysis and a kidney transplant before making your decision.